Hi, Dr. D. Pasquale with NSI, and I want to touch base on an anti-inflammatory diet and what role that plays in helping us overcome certain conditions. And I'm going to talk a little bit about orthopedics, because many people who come to see us, they don't realize the role that their metabolic state plays in the degenerative process. When I say degenerative process, I talk about arthritis. Arthritis is a progressive degeneration of cartilage or cartilage tissue, and inflammation in our body plays a role in that. The question is, why do some people develop arthritis at a fast pace as opposed to others? And you know what? Success leaves clues, and it's important to understand, what role our systems play in our entire body, not just looking at one joint as opposed to another. And in many cases with our patients, and I always talk about, spine cases quite often, because many of our spine patients who are post-surgical, many of our spine patients who have lived with pain for a long period of time on lots and lots of meds, they're extremely toxic, they're extremely inflamed. And we always make recommendations that, hey, an anti-inflammatory diet or a functional medicine protocol like our repair and clear process can be beneficial. It can be beneficial in helping them achieve results where they possibly couldn't achieve results with just regenerative medicine alone. Remember that regenerative medicine or stem cell therapy, it is not a magic wand, but it's an extremely powerful tool. It's the only tool that we have available to us to repair and regenerate some of these damaged tissues, especially with these types of conditions. And having said that, we want to create an environment that's conducive to healing. So for us as an organization, we're not a one-trick pony. At the end of the day, providing stem cells is the easy part. What makes us special is creating an environment that's conducive to healing, is doing the things that are necessary to affect your life and promote healing and support of tissues so that you can have the best possible outcome. And that's, I think, the reason why we're able to get some of these really complex cases that we see better where others just can't. So it's always something to consider, as we make recommendations, and it's something that we'll always talk to patients about. We're not scared to make recommendations whether patients like it or not. The patients always get to choose and decide what they think is appropriate to them, but not until we've educated them enough so that they can make a conscious decision. For us, it's not about telling people what to do. I talk about this quite often with my patients and the people that I consult with. We don't tell people what to do. We educate patients on all of the things that would be necessary to consider before they make a decision about how they're going to improve their health. And we talk to them not just about what we provide, but what the other options may be out in the marketplace or out in the healthcare systems that are available to us. I just wanted to touch base on that just a bit, because I think it's an important part of the puzzle, and I think it's what a lot of other clinics might be missing in terms of getting their outcomes to where they need to be. When we consider all of these systems and when we consider the person as a whole, our outcomes and our success rates go through the roof.